Hi everyone, and welcome to the Passable Parent Channel. My name is Morgan. I've been a pediatric nurse for the past 10 years, specializing in early childhood development. And I'm also a mom, soon to be mom of 2 if you couldn't tell. I'm actually due to be induced tomorrow, so I figured that today was as great of a time as any to go over with you what I'm including in my hospital bag as a second-time mom, and everything you need and don't need to bring with you. The first thing that I'm going to be bringing with me to the hospital is actually for when I'm in active labor. It's a fan. I didn't have this with me when I gave birth to my son, but I'm definitely bringing it with me this time around because I just was in labor for so long. I was so hot. You're pushing, you're sweating. It's a process, and I thought this was great because it'll help keep me cool and relaxed, and it actually has these little arms on it, and it will attach to the side rail of the hospital bed so I can have that cold air blowing on me when I'm in labor just to make the process a little bit more comfortable. Or my husband can hold it for me and fan me, help support me in the process. I thought this was great, and I'll link this down below for you, just like every other item I'll be talking about. It'll be in the description box below. This is not essential, but it's something that I brought for my son. I actually chose to make his baby book with a company, Artifact Uprising, and I'll link them down below for you as well. But I brought a little page from the book that the nurses could stamp his footprints onto, and I want to do the same for this baby, so I'm also going to be bringing this page. I got the same Artifact Uprising baby book, and I'm trying to do all of the same things so that she feels just as special as her brother, and I'm bringing this with me. It's not an essential thing, but if you have a special baby book or something sentimental and you want maybe the nurses to get your baby's footprint and ink it onto one of those items as well, make sure not to forget to pack it in your hospital bag. The next items that I'm going to be bringing with me to the hospital tomorrow are a can of Lysol Spray and a can of Lysol wipes. Hospital staff does a great job of trying to keep the hospital clean, but I did work in a hospital for many years, and you know, public places you have to really think about. And I'm a bit of a germaphobe and neat freak. It makes me feel good to wipe down like the rails of the hospital bed and the little table that they give you, things like that. Just kind of once I get situated in the labor and delivery room, just quickly doing a quick cleaning using these items. I feel that they're essential. I did it the first time. I was in 2020, so we all know what was happening in the world during that time, and it made me feel really good to be able to have these items and just kind of clean a little bit, and I definitely recommend that you also bring them. The next items that I'm going to be including are 2 water bottles, one for myself and one for my husband. You can find them on PassableParent.com. This one says Daddy, and of course has the Passable Parent logo for my husband, and then Mama and the Passable Parent logo for myself. And again, you can find them at PassableParent.com. For active labor, it's really important that you stay hydrated, along with this theme of bringing these nice big reusable water bottles for yourself. You also can pack some snacks for yourself and your partner, your support person, whoever you have there with you, just to make the experience a little bit more comfortable for yourself. Again, your healthcare team will tell you when you need to stop eating, if you do need to stop eating at some point. Other than bringing the water bottles and the fan and some of the other things I mentioned, you really don't need much else for the active stage of labor and delivery. I've seen a lot of videos where people recommend bringing like your own personal little hospital gown or something like that for labor and delivery. I personally just used the hospital gown that was provided for me because it's a messy process, labor and delivery, and you're sweating and you're gross, and I think it's better to just use what they give you and focus on the things that you want to maybe have for yourself to wear postpartum to be a little bit more comfortable. Unfortunately, there's nothing really modest about the labor and delivery process. I suggest just not worrying about trying to pack other things in your hospital bag for the labor and delivery process and just using the items that they provide to you. While I'll be packing some special snacks for myself and my husband, you can really pack snacks or not. It's really up to you. They do have some snacks at the hospital. They many times have cafeterias that are open pretty late. Hopefully your support person can get some food whether you pack these snacks or not. Next item I'm going to be talking about is actually diapers for myself. Now, they do provide these to you in the hospital postpartum, but at my hospital and many of the hospitals that I've worked at, they give you these like little cloth disposable panties and you have to stick pads in them. and it's a mess. The pads like moving all around every which way, and the underwear are one size fits all, and they don't really fit all sizes. And it's really uncomfortable, I found. So I think that made it pretty much more uncomfortable for me the first time around when I had my son 2 years ago. This time around, I'm bringing diapers for myself that I know are the right size, and I'm hoping that it makes my time on the postpartum unit much more comfortable. Definitely packing these. Along with those diapers, I'm also going to be packing some of these Frida Mom instant cold therapy pads. These are pads that you could stick in your diaper or your disposable underwear that break up, and they have a cooling relief. And they do have some of these at the hospital, but I really liked these ones by Frida Mom. So I'm just packing 2 of them, and I'll use the other ones that are provided to me by the hospital staff. I wanted to mention them because these are great to have postpartum as well. The next item I'm going to be bringing with me is just this really nice soft robe that I have, which I can link down below for you. I actually found it on Amazon, and it's so soft. It actually kind of feels very similar to like an UGG robe, which is a 10 times multiple of the price. This is really great, and I will link it down below for you. And I'm bringing it for myself for after labor and delivery, when it's not going to be so sweaty and messy and gross. I can put this on, and I love a nice good robe, especially if you're going to be someone who's going to be attempting breastfeeding. Makes it so much easier to have easy access to that. There's still going to be lots of doctors and healthcare team coming in to take your blood pressure, things like that. A robe can make it much easier for you. I definitely recommend packing just one good, nice, comfortable robe for yourself for after you give birth. And along with that, I'm also going to be packing some nice slippers for myself for after I deliver, and even during the active labor process. It might be nice to have some good socks that are non-slip, or some slippers if you're going to be getting up and moving around during active labor. It really just depends on whether or not you choose to get an epidural. Definitely a good pair of slippers is something to include in your hospital bag. I'm also going to be packing 2 pairs of socks for myself for after I deliver. I'm also packing a pair of flip-flops for that first shower that you get after you deliver, which is heaven sent. I'll be packing a pair of flip-flops for that, so I'm not walking around in my bare feet for that shower in the hospital shower. Now, they do give you hospital towels, but they can be really scratchy, and I swear, they're the smallest towels you've ever seen. Me and my friends joke about it all the time, but these towels are like hand towels that they expect you to dry your body with, so definitely ask for extra towels. I don't think you need to pack a towel, but if you have a towel that will just feel softer on your skin after labor and delivery, feel free to pack it. The towels that they do provide you at the hospital tend to be pretty scratchy, and the smallest towels you'll ever see in your life for your body. Let me know down below in the comment section after you deliver if you also think those towels are ridiculous, or if your hospital has nicer towels. But I will mention that, so you may want to bring a towel for yourself, you may not. I'm also going to be packing a nice bra for myself that is comfortable for nursing. So if you are going to be breastfeeding, you want to think about that. If you're going to be wearing a bra, you might not even want to wear a bra postpartum. So you might just want to have a robe on and don't worry about the bra, because it can be pretty constricting. But I am going to be packing a bra, just one, and I'll also be wearing this home. I found this to be really comfortable. These are actually, I found them at Aerie, and it's just a regular like sports bra, but I don't know, very comfortable. And for me, this is what I wore most of the time postpartum. I also have some really nice clip down bras for breastfeeding, so I'll make sure to link those all down below for you in the description box. I'm also packing just some other essentials for myself, like deodorant, toothbrush, toothpaste, makeup removing wipes. I'm packing this little kit of my favorite face moisturizer and face wash by Fresh Cosmetics, little thing from Sephora that my sister-in-law got for me. I'll be packing this with me because it includes the small travel size bottles of face wash and moisturizer. This is great. That's all you really need. I'm also going to be packing this mirror that I found on Amazon to be able to do my makeup if I have the energy. I'm not going to push it postpartum. We'll see. I'm thinking, oh, it might be nice to be able to do my makeup if I just put this on the little table. It's really cool, so I'll link it for you because it sits on the table and it has this really nice light, so you can really see what you're doing. and I'm packing my makeup, and this is if I have the energy and baby's doing well, and maybe I can get some cute pictures with her with my makeup done. Being optimistic, we'll see the energy level that I have postpartum. Nothing different than my normal. I just put it in this Ziploc bag to keep it easy and contained for myself. The next item I'm going to be talking about is a sound machine. The hospital's loud, there's all these noises, and it keeps you awake, it keeps baby awake, and I brought a sound machine with me last time around, and I'm definitely bringing a sound machine with me this time. Found this one. I really like this one. It's on Amazon. I'll link it for you below. This one works great. It has a really nice white noise sound, fan sound to it. Definitely bringing this. Hopefully me and baby can get some sleep. Just so you know, people come in about every 4 hours to check on you. I'm hoping I can kind of, negotiate to get a little bit more time at night, but we'll see. They have to do what they have to do to keep you and baby safe. It's not going to be great sleep postpartum in the hospital. Just know that going into it with a baby and with having to have all these assessments done. But anything you can pack that makes you more comfortable to sleep better, I definitely recommend. For me, a sound machine, a fan is a great one. I'm also going to be packing my silk eye mask. I cannot sleep without one of these. If you have any items that you need to help you sleep and be more comfortable, pack them. Don't forget them. If you also like silk eye masks, I will link this down below for you. Don't forget your cell phone charger. You're going to be taking so many pictures and videos of that cute little baby, or your partner will be for you. You're going to want your charger, and you're going to want to be able to tell people that baby's here and have a way to contact people, so don't forget your phone charger. I'm also going to be bringing with me the Owlet Smart Sock. I have this for my son still, and he's over 2 years old, and I love it. It gives me such peace of mind. It tells you your baby's heart rate and pulse ox, and he still is using it. I don't know, we just got him the sock that extends it up to age 5, and I'm not sure that I'm ever going to want to part with it because it gives me such peace of mind. For the new baby, we are bringing this to the hospital, and the base station alerts you and notifies you if your baby's heart rate is too high or too low, or same thing with their pulse oxygenation levels. Now, this might not be essential for everyone. There are going to be people monitoring your baby while you're at the hospital, so it's really at your discretion. If this is something that sounds interesting to you, I highly recommend it, especially through the first year of life and those first 6 months. Just really helped me sleep better at night to know that my baby was breathing well and had a good heart rate. Can't recommend it enough. I'll be bringing this to the hospital. The next item I'm going to be talking to you about is the My Breast Friend pillow. If you've seen some of my other videos, this is something I frequently talk about. I breastfed my son for almost 2 years, and now while he grew out of this thing, after I would say, oh geez, we were pushing it. I was maybe still trying to use it on him when he was 7 months old or so, and his feet were hanging off the side of it, but it just became such a comfort and so comfortable for me with breastfeeding. I didn't bring it to the hospital with me the first time around. Breastfeeding is hard. It is really tough, and it was a struggle the days in the hospital trying to figure out the correct positioning and how to get a good latch and all of those things. And make sure to check out my other videos because I have a ton on the topic of breastfeeding to help support you in that journey if that's something that you want to try. I ended up getting one of these when I got home, and it just made things easier for me. I was able to get better positioning, better latch. This time around, while this is pretty bulky and I'm going to have to smash it down into my hospital bag, which is quickly growing in size, it's worth it. Anything to help make it easier for you in your breastfeeding journey, if that's something you decide to do, I highly recommend, and this really helped me. This pillow is so great because it's adjustable. I've seen people use things like the boppy pillow and like that for nursing, but those don't seem to really work as well. They're not really a one-size-fits-all, even though they say they are. This is great because it's completely adjustable, the My Breast Friend pillow. And you also have this little pouch here for snacks or your water bottle. And it's just a great pillow. I seriously love this thing. I will never stop saying positive things about it. I feel like it's going to be essential and really help me in the breastfeeding journey the first couple days. I'll report back to you and let you know, but I think this is going to be a good decision. Wait till I tell you about the last item, which is something I definitely wish I had the first time around, and it would have made my life so much easier with a new baby if I would have had it right away. The next item to bring to the hospital for baby is the Happiest Baby sleep sacks. I find them to be the best out there. They're the company that makes the snoo. Whether or not you have a snoo, I find these sleep sacks to be the best because they are just so easy. Instead of trying to swaddle your baby and figure that all out, which they're gonna break out of it about 1,000,000 times while you're in the hospital. You're sleep deprived, you just gave birth. There's gonna be nurses coming in, you're gonna be calling them in, please reswaddle my baby. And then basically as soon as they walk out the door, the baby's gonna be unswaddled. At least that was the case for us with our son. I definitely recommend a swaddle like this. Even as a nurse, I can't stand a regular swaddle. They break out of them so quick. It's very simple to do, this swaddle, and it's all Velcro. You just Velcro their arms down by their sides, and then this is where their little legs will go through this, and the Velcro right here. And then you have this zipper, and voila, they're swaddled. You don't have to worry about how to wrap the blanket and get it under them and get it tight. This just makes it so much simpler. So I'm bringing this with me, and I also have the snoo at home. I love the snoo bassinet, and I wanted her to have this swaddle so that way she's used to it. Even though this is not one of the ones that goes into the snoo, those have little wings on the side that clip down into the snoo. Still is the same, exactly the same. It's just missing the little wings on the side. I wanted her to be used to that before she gets home and right away be used to this particular swaddle. So if you have a special swaddle that you're going to be using for your baby, whether or not you have the snoo bassinet, whatever bassinet you have or crib, bring that swaddle with you, at least one of them. And I recommend the ones with Velcro that make your life easier and zippers as opposed to just a traditional swaddle blanket. I am bringing a traditional swaddle blanket, but it's not going to be to swaddle her. It's just going to be for extra warmth because I want to make sure we get tons of skin to skin time. I'm not really packing her a ton of clothes because skin to skin is so important with your baby. Most of the time she's going to be down to her diaper and on my bare chest with her bare chest because it's so good for your baby's health. It regulates their heart rate, their temperature. They just came out, they just were born in this big scary world with all these new sights and smells. And skin to skin is one of the best things you can do for your baby and their development. Just bringing this that I can kind of lay over her and me while she's doing skin to skin with me on my chest. Next, I'm going to be showing you my going home outfit, what I'm going to be wearing home. I just found this really nice set on Amazon. It's super soft and extra big and comfy because while your belly's probably going to shrink up postpartum, varies woman by woman. I kind of deflated a little bit like a balloon the first time around, but then seemed to carry some extra pounds. It took some work to get them off. Assuming it'll go similarly this time, but you know, if not, my body just did this amazing thing. That being said, ordered really comfy set, large, just so that way I can be really comfortable. And this is what I'm going to be wearing home. Adjustable waistband, really soft fabric, really nice. And actually I found it on Amazon, so I will also link this below for you if you're interested. It comes in a ton of colors. I also have two outfits, which I'm unsure which one I'm going to be taking her home in, but definitely will be snapping some first photos for her at the hospital in them. I got a similar outfit or two for her brother right after he was born. Do the same for her. This is the first one. I think it's so cute, and I actually had it custom embroidered. I love it so much, and matching little white bow to go along with it. That's the first outfit. And I have this little outfit with this matching little hat with a bow. So I don't know, they're both so cute. I can't decide which one she's gonna wear home or for her first pictures. Other one's just newborn size. I'm just packing the two of them. We'll see which one I want to take her home in. Try to not bring too much because like I said, she's probably going to be in a diaper most of the time we're at the hospital, so don't go too crazy packing a ton of things, but it's hard. They're all so cute. And my final item that I was talking about earlier that I wish I knew existed, and you really don't need to bring many baby clothes with you to the hospital, especially if you're going to be prioritizing that skin to skin, is the magnetic knees. I wish I knew about these for baby. I figured it out pretty quickly postpartum and ordered a bunch of them. They're lifesavers, and they just are so easy because there's little magnets in here, and they use this Zone Safe technology, I believe it's called, to make sure that they are securely in there, and it just fastens like this. So when you're so sleep deprived in the beginning, in the middle of the night, you can't see, you don't have to worry about buttons and everything else, and you can change baby quickly in them. They just snap together, little magnets. And they're so cute. They have, this is of course for a girl baby, so there's little ruffles on the butt. So cute. I had really cute ones for my son too. I love this company. It's the softest fabric. These are game changers for new parents. You think like, oh, it's not that big of a deal. Like, I'll get the things with the buttons and the snaps and all this. And then you have a baby and you haven't slept. So definitely recommend these. They're amazing. And also I got myself a matching set, which I figure is going to be so great for breastfeeding because the same magnetic fasteners. It's going to make it so much easier. And I did pack this for the hospital, these matching outfits. Like I said, we're going to be doing a lot of skin to skin, so I don't know how much we'll be wearing it, but probably I will have her in it so she's warm enough when she's sleeping. And yeah, that is my final item. Definitely recommend magnetic knees. Don't forget to like and subscribe, and next time you see me, I won't be this pregnant.